Good morning, students. Today we are going to start a very significant topic, that is methods of contraception. Before that, let's see what is contraception all about. So in simple way, we can say contraception means prevention of the pregnancy. Stopping of pregnancy is called contraception, and the technique used in preventing the occurrence of pregnancy are called contraceptive devices. So pregnancy can be controlled by using some contraceptive devices. Now, why this contraception is very important? So there are few factors which will indicate the importance of contraception. So first reason for contraception can be spacing out the birth of the children. So if the family decide or the couple decide to have some spacing or time gap between the birth of the children, so this can be used, because the health of the mother is very crucial. Now if the family or the couple doesn't want child, that time also contraception can be used, or these devices can be used. So nowadays there are n number of methods of contraception. So first one is physical barrier method, second one is surgical method. This is surgical method is considered to be permanent method, and others 1, 2 and 3, these three are temporary methods. Surgical method is considered to be the permanent contraception. It is irreversible. Once it is done, so it is irreversible. So generally a few couples, they go for the surgical method after having a proper consent, family consent. So now first let's deal with the temporary method. First is the physical barrier. This physical barrier is like using condoms, that is used by the male, and diaphragm and cervical caps, these are used by the females. Cervical caps, as the name suggests, it is used or it is worn in the cervix, and diaphragm is used in the vagina. Now surgical method, these are the permanent method, as I already told you. Now what happens, there are two surgical method. One is vasectomy, which is done in male, and tubectomy is done in females. What is all about vasectomy? It is related to vas deferens. Vas deferens is the sperm duct. Sperm duct is cut and tied. Why it is cut and tied later? So that this prevents the sperm to come to move ahead, or you can say it prevents the sperm transfer basically. So once the sperm duct is cut and tied, so it prevents the movement of the sperm in the sperm duct. Second, in case of female, means females also can go for the surgical method, which is permanent method. So here what happens, the fallopian tube, that is the fallopian tube of the female, is cut and tied, and this stops the egg to reach to the uterus. So these are permanent methods basically, and irreversible methods. Now next one is the chemical method, widely used by the female, like they use oral contraceptives, like and oral contraceptives, like you must have heard about Mala, Saheli. Many oral contraceptives are available, but there are some side effects which are associated with them, because they all change, these oral contraceptives which are used by the female, they change the hormonal balance in the body, and with the change in hormonal balance, the females, they can face some problems like acne problem or weight gain problem, vomiting. So many ill effects or the side effects are associated. Now IUCD, nowadays the females are going for this contraceptive method, that is IUCD. Sometimes they ask you the full form of this. So IUCD is intrauterine contraceptive device. Intrauterine contraceptive device, or it is also called copper T, or a loop is placed in uterus. So IUCD, that copper T is placed in uterus, diaphragm is used in the vagina and cervical cap is used in the cervix. So thank you very much.